Hello, everyone. Thank you for attending the webinar for the Doula Specialized Services RFP. I'm going to remind everyone that we are recording and that this will be posted online shortly after we are finished here. You will have the option to submit questions. If you look at the bottom of your screen, you should see a Q&A box. Please do submit questions through that portal as we're talking, and we will make sure to take time at the end to address those questions. So just some quick housekeeping before I hand this over to Sir Rachel. Due to the volume of participants, you are on mute. That's also why we ask that you submit your questions via the Q&A box. So please do submit those questions and we'll respond at the end of the presentation. We're also going to upload answers to any questions that come up into our e-procurement portal, so you will be able to view them later. This webinar is being recorded, and a copy of the recording will be posted on the DFSS YouTube channel. And the PowerPoint slides will be available there as well, approximately a week after this is completed. So I'm going to go ahead and run us through the agenda, and then I'll hand it over. We're starting here with welcome and introductions, and then we'll get through to the RFP itself, its purpose, background information, the program scope, those selection criteria that our applicants should be attending to, the application timeline, and how to access any necessary technical assistance for e-procurement. As far as introductions, my name is Alexa Karchmar, she, her, hers. I'm a principal operations analyst here at DFSS. And I'll hand it to Sir Rachel.
Alexa, I'm Sir Rachel Burgess Burnett. I'm the Deputy Commissioner here in the Children's Services Division. And we are responsible for early learning programming across the city of Chicago, which includes the services, the specialized services, Doula, that we're here to discuss today. So we can move forward. So the purpose of this RFP, we are seeking 6 entities in the city of Chicago that can provide doula specialized services to low socioeconomic status individuals, specifically first-time pregnant people under the age of 25 who may be at risk for other factors such as teen mom, homelessness, substance abuse, ethnicity, the language, second language, or other underlying medical conditions. Ideally, our respondents should currently operate a prevention initiative or a PI home visiting program, either through DFSS or the Illinois State Board of Education, and includes an existing doula model. To be considered for eligibility, the respondent must directly provide doula specialized services. When I say direct, meaning that the respondent who will be awarded must themselves provide doula services. This is not allowed to subcontract outside of your organization. PI home visiting and doula specialized services must be provided directly by your agency staff. So the background. One of the things we want everyone to understand is it's really important that we think about the services that we provide, that we're working across the lifespan. And so having a program such as Doula allows us to work with pregnant moms so that we're able to reach that mom during that really key period of her pregnancy with the hope of course, a healthy, sustained pregnancy. And so one of the things I want you to do when you're reading the RFP is I want you to read the current and state things that are listed in there. But I also want you to understand that based on some of that information, there's some specific things that we're looking for. And this is based on only one doula. So when I'm saying these numbers, one doula over the span of a year, we're anticipating would do the following. that they will work with their families, the parents, and we want 9 healthy, non-invasive deliveries. And we would anticipate some cesarean sections, but we're hoping and would be looking for only 3 of those. In other words, there's about 12 parents within those deliveries, 9 are healthy, and then of course, 3 number of cesarean section deliveries. We want those parents to complete satisfaction surveys. So again, 10 satisfaction surveys, 10 first-time pregnant moms under age 25 who have other risk factors. So assessing for the other risk factors is a requirement. And that you're operating annual prenatal group sessions. We want to make sure that the parents have opportunities to participate in prenatal group sessions. They're meeting other moms. They're then being able to talk to other individuals who are going and experiencing some of the same things. We want babies to be breastfed. So again, out of looking at 1 doula in their caseload, 7 babies being breastfed. 9 children then would transition to long-term prevention initiative or PI home visiting program. What we also want is to make sure that families are given opportunities for referrals. And so we're looking for 3 of those parents to be referred to other services. But all 12 of the parents would be screened for postpartum depression. Again, we started off with 12 parents, and what we're looking at here is 12 of them being screened for postpartum depression. Next slide, please. And so the overall goal of this specialized program is to improve birth outcomes and promote the attachment process by providing prenatal support and education support during the labor and delivery process, and postnatal home visits, which are aimed at promoting strong parent-child relationships and paving the way for a smooth transition to long-term home visiting services, which is a part of what we're looking for. Doula specialized services are home visiting programs that may consider to be the front door for many of our parents toward their entry into long-term PI home visiting in order to provide a family a continuum of care. Doula specialized services may commence at the beginning of the 3rd trimester of the pregnancy, but then is required to continue for 2 months after the child is born for a total of 5 months. The Doula Specialized Services Program model is not intended to be standalone. We're not wanting a program that is standing alone and only operating doula services. Instead, it has to be integrated and provided concurrently, ideally within a PI-funded evidence-based home visiting program that aligns with our Chicago Early Learning Standards model. The home visitor, concurrent to the doula, continues to develop a relationship with the family, so the family continues to feel supported at the end of the doula specialized services. What we want is a smooth handoff. It is recommended that the home visitor and doula schedule home visits together. That is recommended so that development of that relationship is already built. The Chicago Early Learning Standards helps guide the implementation of these services of the Doula Specialized Service Program. Next slide, please. Currently, we're funding 6 doula services programs, and they are operating in targeted communities, which I will show a little bit later in slides. But there are 2 following priorities that are really we're looking for improvement. Anytime we're offering programs, we're always looking to improve. So I've got 2. An individual with clinical experience as part of the Doula Specialized Services Program, so that the doula has support that they might need to serve the participants. They may have medically complicated pregnancies and they need to have someone that they can converse with and talk to about what's going on with the parent that they're working with. These consultants are generally registered nurses, midwives, or other professionals who have some training in the medical aspects of pregnancy and childbirth. They are generally contracted for about 10 hours per month. As part of a comprehensive recruitment plan, the program should have memorandums of understandings and agreements or community partnerships in place with prenatal clinics, WIC programs, hospitals, and others providing medical services and community to ensure that pregnant people in the program's target population are referred for doula services. This is another way to boost recruitment, is that they know that you exist within your community and providing these services. Next slide. Priority participants are low income, first-time pregnant people under the age of 25 who have other risk factors noted below They must live in the city of Chicago. They must be able to document that they have a city of Chicago address. They are then enrolled or eligible for the PI home visiting program and other early childhood programs that may be offered at that site. Other risk factors that impact eligibility may include, but are not limited to, teen moms, women of color, specifically Latino or African American, individuals who are homeless, those who are suffering through substance abuse, single parents, those with limited English speaking proficiency skills, who have underlying medical conditions such as hypertension, diabetes, obesity, all of which we know impacts pregnancy and healthy deliveries, and other proposed risk factors that may negatively impact their pregnancy and that child. And so we know that we want to serve those highest in need, and that's why we list these. Eligible program participants are typically families who are under 400% of federal poverty, or FPL, and should include other risk factors that align with eligibility criteria as determined by the program. Families must provide documentation that supports their income eligibility, and for the PI visiting program, including documentation that supports their at-risk designation. Next slide, please. So we do have priority communities. We've talked about at-risk factors, but we also want to make sure that you understand we do have specific communities that we're targeting for doula specialized services. While DFSS seeks to fund agencies across the city, for this RFP, the following targeted communities will be prioritized by a capacity to serve birth to 3-year-olds under 400% of the federal poverty level. Infant mortality rates, death to infants aged under 1 year, denotes on this list, so you will see the asterisk behind some of those community areas. We also are looking at COVID-19 mortality rates, and there's that denotion there for you. And these are all listed for you. These are the community areas, again, that we're targeting because we do want to meet and serve those at highest risk. Next slide, please. Successful respondents must meet the following qualifications. The program supervisor must have at minimum a bachelor's degree in child development, psychology, or social work, and experience working with doula programs. A master's degree and above is preferred. Doulas must meet Chicago Early Learning Standards, PI home visitor minimum qualifications, and preferably be certified by Doulas of North America, or commonly known as DONA. An individual with clinical experience, registered nurses, midwives, or other professionals who have some training in the medical aspect of pregnancy and childbirth. The home visitor will need to have a Gateways Family Specialist Credential Level 5 by 2024. Note, some home visitors will need to have a bachelor's degree while pursuing their Gateways credential, so they may be doing both. The implemented doula specialized services model will be integrated into a long-term PI home visiting program that use either Healthy Families or Parents as Teacher as their curriculum model. And these are offered at each of our Chicago early learning sites. And so this is one of those common threads amongst all of our PI programs. Next slide, please. Doulas are required to attend approximately 2 births every month, and they must be available 24/7, meaning 24 hours a day, 7 days a week. An important factor for doula specialized services programs must take into account in their hiring and scheduling practices the fact that births often happen outside of normal working hours. That's why that note is there, 24/7. Doulas must have flexible schedules because it is crucial that they be present during labor and delivery. Programs need to ensure that there is some backup capacity so that participants can still receive doula support when their primary doula is on vacation, ill, unable to attend a birth, or when there are vacancies in the program. This will generally mean having at least 2 doula as part of a program staffing pattern. But backup can also be achieved by having a supervisor trained as a doula or by having a part-time person who can fulfill that role. In the absence of the doula, they can work part-time. Because births happen at different times and hours of the day, doulas must be on call and have staffing to support the doula. For smaller programs, this may be the supervisor that possesses the minimum training and/or credentials. Therefore, doula specialized services programs must provide a full-time doula caseload with 20 to 23 people over the course of a year and limit that doula intervention to a 5-month period. That begins at the 3rd trimester of the pregnancy and then continuing 2 months after the child is born. Again, the caseload is 20 to 23 over the course of a year, and that has to do with the different births at different times and making sure that the doula can be, again, available for labor and delivery. A full-time doula typically has a static caseload of no more than 9 at any one time over the span of a year, 20 to 23, but should not have any more than 12 at any one time. The caseload shall be a mixture of individuals who are pregnant and who are postpartum. DFSS through this RFP anticipates funding 216 pregnant new moms. The budget is defined, will offer a maximum cost rate of $4,400 per enrolled mom. And slots will be awarded based on the proposed program alignment, defining the appropriate number of doula, 1 to 12 as mentioned before, a doula to a pregnant mom, and that ratio projecting no more than 23 pregnant moms over the course of a year. Next slide. Doulas are required to develop, organize, and facilitate monthly prenatal groups depending on above described caseload, which we just went over. And during that prenatal group, topics should include, for example, introduction to baby basics, nutrition, building healthy eating habits, exercise in pregnancy, and breastfeeding, labor and delivery, postpartum care for parent and baby along. Along with these discussion of these challenges of pregnancy, childbirth, and the postpartum period. Prenatal groups offer an efficient way for parents to learn about prenatal care and the birthing process while connecting with a peer group and continuing to build a relationship with their doula. Doulas are required to provide screening for perinatal and postpartum depression, as recommended by an evidence-based doula certification training organization such as DONA International. Referrals to other providers would be made depending on the results of the doctor's notes and clinical psychologists, so the preparation for referrals is needed. Doulas act as a resource and support for the parent as they go through the birthing process. One of the primary focuses of a doula is to develop a strong, caring, and trusting relationship with the parent that serves as a model for the new parent to use as they develop their own relationship with their new child. The doula will listen to the needs and concerns of the parent and family and refer to health services, social services, and government services as needed. DFSS seeks respondents with evidence of strong past performance against desired outcome goals. Some performance indicators include that the doula specialized services provider is required to provide doula services as an integrated part of a long-term evidence-based PI home visiting program or other early childhood program model in order to improve outcomes of pregnant people under the age of 25 who may have other risk factors. As such, performance outcomes will be assessed in the following manners: support the development of a strong parent-child relationship that serves as the foundation for the child's health and development, support healthy births, and promote healthy growth in the child. Next slide. To monitor and recognize intermediate progress toward the above or just mentioned above performance indicators, DFSS also intends to track output metrics that may include but are not limited to, based on anticipated results, again for one doula, and I'm restating these for you: 9 healthy non-invasive deliveries, 3 number of cesarean section deliveries, 10 parents satisfaction surveys, 10 first-time pregnant people under age of 25 who may have other risk factors, annual prenatal group sessions held, 7 babies being breastfed. We want 9 children to transition to a long-term PI home visiting program. We want 3 referrals to other services, making sure that you have those connections to other programs and services. And then all parents, 12 screenings for postpartum depression. In addition to the performance indicators and output metrics listed above, DFSS encourages applicants to propose additional indicators and metrics, including those that demonstrate early success and are indicative of participants' progress. Next slide. The respondent clearly defines services to be provided directly through linkages, agreements, or partnerships with other agencies that are appropriate to address the needs of and achieving desired outcomes of the target population. The respondent's proposed program is supported by a strong national or local evidence base and/or aligns with best practices for the relevant field. The respondent has an effective approach to identifying and retaining program participants, including rules, regulations that reduce barriers to participation. The respondent has partnerships or coordinates with other agencies to expand or improve services in a client-centered, comprehensive way. Respondent clearly defines an effective system to identify and enroll first-time moms into their doula program. The respondent demonstrates the ability to successfully transition families out of doula care and into other supportive services. Next slide. The respondent demonstrates evidence of strong past performance against these desired outcomes, and the respondent has experience using data to inform and improve its services or practices. The respondent has the relevant systems and processes needed to collect, store, and key participant and performance data. This is one of the selection criteria for program performance, outcomes, and quality. Again, when reading the RFP, you will see these. Let's go to the next one. Selection criteria for organizational capacity. We're seeking respondents that demonstrate qualified staff responsible for program oversight and management. The respondent has adequate systems and processes to support monitoring program expenditures and fiscal controls. The respondent has adequate human resources capacity to hire and manage staff. And the respondent will have the capacity to meet the required ratio of 3 PI home visitors per 1 doula per ISBE requirements. Selection criteria: reasonable cost, budget, justification, and leverage of funds. Seeking respondents who can demonstrate that they have the fiscal capacity to implement the proposed program. The respondent leverages other funds in-kind contributions to support total program and administrative costs. That could be state, federal, foundation, corporate, or individual donations. The respondent demonstrates reasonable implementation costs and funding requests relative to its financial and human resources. The proposed budget supports the proposed scope of work or work plan. The respondent develops a budget that aligns the doula caseload per requirement stated in the RFP to the number of families they project to serve. The respondent demonstrates an ability to track the flow of donated goods and services. Next slide. Attachments that must come with your application. Be sure to attach reports, studies, or other documentation that show performance toward reaching the program goals, demonstrate results and accomplishments. Be sure to attach the resumes of key staff that are overseeing the program. Be sure to attach the credentials for the doula staff who will work in your program. And be sure to attach your organization's budget for this program. Please make sure all program requirements are addressed in the budget. Next slide. Selection and transition timeline. The pre-proposal webinar that you're listening to today. Applications are due October 13th, 2023, and the program period would begin December 1 of 2023. In the RFP, what you will see is the term of the contract. That will be executed under this RFP will be from December 1, 2023 to November 2025. And based on need and availability of funds, contractor performance, DFSS may extend this term for up to 1 additional year with an extension not to exceed 1 year. The total funding for this RFP for 1 year is $952,000. The slot amount will be $4,400. Administrative cap for this program should not exceed 5%. No matches required because this is PI state funding. Please submit a budget for 1 12-month period for services for doula services. Cost category definitions are attached as budget instructions in every RFP. Be thoughtful and inclusive when developing your budget. Apply for your program's actual costs. And we know that we cannot give you more money than what you ask for. However, we can give you less. Use reasonable cost questions on the application. Use the reasonable cost questions on the application to discuss how you determine the cost reflected in your budget. Some common errors that happen. Fringes, check your calculations, please. Supplies, they're frequently under or over budgeted. Client assistance. If this is an appropriate and allowable cost, don't forget to include it. Make sure your job description titles and your job description uploads have the same title. Also put a brief description on the job in the budget document itself if you have not discussed it specifically in your application. And put your budget in the appropriate column. And I mentioned before, you don't have to do a match, but what we described earlier is if you are getting donated services, this is a good place for you to discuss some of those. Thank you. Applications are due on October 13th, 2023 at 12 noon. Again, 12 noon. We say that more than once purposely. We want to make sure that you know the time frame. No application can be accepted after, and they are all due 12 noon, October 13th, 2023.
Thank you so much, Sarethel. I'll give you a break and I'll do some of the technical nonsense for a bit. All right, everyone. So if you are a first-time applicant, especially, we like to let people know that they should start as early as possible. It does take a few days to actually register and create an account in eProcurement. And so you want to budget for those few days just to get your account up and running prior to starting your application process. Make sure you review the RFP narrative and application questions very closely. Remember that they align with the program scope and the selection criteria. So these are very clear indicators of how you will be scored on your application. Use the information in the RFP for guidance in formulating your answers. There is a 4,000 character limit, which includes punctuation and spaces, but that's for each individual response. So each response is allocated 4,000 words or 4,000 characters. And do not use the back button on your browser that you might lose data in your application. So please only use navigation that's embedded in eProcurement itself. And save often. Save every time you make a major change. Other tips we have. So if for any reason you are submitting multiple applications, you would need to set up separate user accounts for each application. They can be tied to the same email address, however. I apologize. And they must be tied to separate email addresses. So if you plan to submit multiple applications, please create those multiple accounts. You can submit your application and continue to amend it until that due date of October 13th at noon. So if you submit something and then you find that you want to make a change, you should be able to go into the portal and make those changes until noon on October 13th. And in just a moment, I'll give you the information for our helpline should you have any trouble with that. Avoid the rush and any possible mishaps by submitting early, and plan for your submission process to take about 30 to 60 minutes in the portal, particularly if others are applying at the same time. it might just slow down the process. Late applications will not be accepted. And make use of the e-procurement hotline. So if you're struggling with the online portal in any way, or you're unsure about the status of your account or your submission, you can go ahead and give us a call at 312-744-4357. And just note that those operate during normal business hours, that hotline. So that would be Monday through Friday, 9 to 5. If you're a new agency applying for your first contract with DFSS, please do provide these attachments. So we're going to need your articles of incorporation and any related amendments. We'll need your IRS affirmation letter if you are a nonprofit agency. And this can be provided after your submission, as long as it is within 60 days of the date of submission. We will need your DUNS number, and we will need your central contractor registration. And you can go to the sam.gov website for more information on providing the central contractor registration overview page to us. And then we'll need a certificate of good standing letter with the state of Illinois to ensure that you're in compliance with state regulations. For any technical assistance, again, if you struggle with the e-procurement portal in any way, or have any questions about the submission process itself, there is a link to any RFPs of interest on the DFSS webpage. You can check our alerts section, and you can also email us at customersupport@cityofchicago.org, or you can call that hotline number. That was 312-744-4357. These slides will also be posted on our website, so in that alerts section, and that will provide you with the link here to our training materials should you have any further questions or need any further support using e-procurement. And then quickly, I wanted to review how to accept an amendment in e-procurement, because if any questions are submitted during today's webinar, or if any other changes are made to the RFP, then we will be submitting those via an amendment in e-procurement, and it will require that you accept that amendment as part of your submission process. That's just to demonstrate that all applicants have the same access to the same information when they're submitting their application to the RFP. And so even if you've already submitted, if we post an amendment, you should go in and check, and you also should receive an alert and be able to accept that amendment. So I'll walk you through that quickly. If the RFP you're interested in has been amended, then prior to you starting your application, then as you begin your application, it will ask you to view the amendment history and acknowledge the existing amendment. So click view amendment history if you see this warning pop up at the top of your application. And then you will be able to follow the prompts to accept that amendment. If there has not been an amendment yet, then all you have to do is select this create quote and select go. That will take you to the application page to get started on your application. When accepting and acknowledging an amendment, open the RFP, click on the document number here on the left-hand side, review amended changes to the RFP. So you can click on this infinity glass here to review the changes that have been made to the RFP. And then you're going to click this button, acknowledge amendments. And by acknowledging the amendment, you're indicating that you're aware of the changes made to the RFP that you must address in your application. Then you'll be forwarded to this screen, and you'll have to click this button here to say that you accept the terms of the amendment and click acknowledge. And then you will get a final confirmation page. This is an error we see a lot, so be sure to wait for this final confirmation page and click yes to finally submit your acknowledgement. And then, it will present you with basic terms of accepting the amendment and the expectations that follow. And again, you'll be asked to check that you've read and accepted the terms and click accept. So this is a multi-step process. We just ask that you not leave the screen until you see all the way through. And I believe you should see just a final confirmation page come up after you click that submission. Basics on how to submit your application. So when you're ready to submit, make sure that you're saving your draft prior to submitting. Any changes you might have made last minute, you want to make sure that those will appear in your final application. So save your draft and then click continue. And then if there are any missing items, you're going to see an error appear at the top of the page, and it should cite specifically what is missing in your application so that you can go back and fix the error. So for example, here in this message, the error message says the RFQ control requires you to quote on all lines. So you would go to the lines section of the application and make sure that you've filled out every single line. When they say quotes, they mean, you know, every quote is an answer to an individual prompt. So making sure that you go to this section and that you've completed every prompt. So here's another example. There's an unanswered question. It says a quote value is required for requirement first name, and then you go under the requirements section, first name, and see that it's blank. So whenever you receive an error, it should point you directly to what needs to be completed in the application. Once your application is free from errors, you're going to go ahead and see this submission page here. You can click continue, and then you will be in this review and submit phase. And as part of this phase, the final thing you should see is this full printout or sort of summation of your application with all of the relevant entries. Just review that and make sure that everything's saved as you intended it to. Once you review that, at the bottom of the screen, there's an electronic signature prompt. You can fill in the signature and then check this box. So you fill in your signature and then you check the box that agrees to submitting the proposal itself. And then you click submit. And this is the confirmation screen that you want to make sure that you see after you've gone through this entire process. It should say confirmation RFQ number has been submitted. So that's how you know that you've completed the entire process. The e-procurement system will also send a confirmation email within 24 hours of your submission. So you'll receive that confirmation shortly thereafter. You can also call or email us. We'll give you our contact information at the end of the presentation, should you want to confirm that your submission went through. And that's all we have for you today. I'm going to go ahead and I don't see any open questions. But I want to give everyone just a moment. If you want to go ahead and submit any questions in the Q&A box at this time, we'll make sure to address them. Otherwise, we can let you all have the rest of your afternoon back. And here's while I'm waiting to see if anyone submits questions, here's the direct contact information for myself and Sarathel. So for any programmatic questions, please do speak with the Deputy Commissioner. For any e-procurement questions, technical assistance, you can contact me. And again, I'm Alexa, and there's my email address. I'm not seeing any open questions, so please do send any questions via email if they come up, but otherwise, I think I'll let us go. And thank you so much, DC, for presenting and sharing about the program. All right. I will let everyone go. Have a good night.